brain, it's gone to the liver, the likelihood of a little more topotecan, it may be great for the doctor, maybe he'll get paid for it, but I don't think it's going to help the patient one iota. So overall, endometrial cancer, we found the cause of the pain, we found the cause of the numbness, we found the cause of the weight loss, we're addressing them all. I think she's going to feel better, she's going to get off that chemo, hopefully we'll get off the narcotics, and hopefully we'll get the pain, suffering, numbness gone. And that's the kind of work that we do at Radiosurgery New York. This is Dr. Lederman. By the way, we're located at 1384 Broadway. People often ask that. How do you find us? We're 212 choices. We think you should have all the chances. We think you should have all the choices, the most choices. That's why our phone number is even 212 choices, which is 212-246-4237. And we have a booklet to send you about our work. We have 3 separate booklets and DVD. There's a booklet about brain tumors and brain cancers, like I've talked about in these couple patients. There's a booklet about cancers of the body radiosurgery. And there's a separate booklet about prostate cancer and all the data. Who else gives you actual data? I don't think anybody does. Anyway, you can get the booklets. Call our office during business hours, Monday through Friday, 9 to 5, 212-CHOICES, 212-246-4237, 212-246-4237. Of course, the best way to know about your case is to come in, close the door, sit down, stay a while, and just like these other patients, get to the bottom of your case. This is Dr. Lederman. We're going to have a word from our couple new voices, and then we'll be back to take your questions and talk more. Here we go.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD called 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, it's Dr. Lederman here. We're back. We have a caller, so let's speak to George about lymphoma. Good morning, George. Can you hear me? No? Okay. Can you hear me, George?
Yep.
Okay. What's your question?
All right. I've been listening for quite a while, and then about a month ago, I got diagnosed with lymphoma.
Sorry to hear that.
Yeah, I am too, and I'm scared to death about it.
I can imagine.
I'm 85.
Congratulations.
Thank you. Well, up till now, it's been congratulatory.
Well,
I've
most
never
likely
heard
will continue.
I've never heard you discuss this situation on your program. It's in the left side of my neck. There's a lump, and I want to know: do you handle it? Do you treat it? And what are the odds? And tell me anything you can.
Okay, so first of all, happy Father's Day, so I'll tell you that. Number one. Number two, is the lymphoma anywhere else in your body?
Not that we know of yet.
Okay, so then it's localized. It's either stage 1 or stage 2. Have they done a biopsy?
I've had a needle aspiration, but he wants to do a further biopsy of some sort.
And what does the needle aspiration show?
He didn't tell me.
Okay, well, that's what I'm talking about.
I know.
That's exactly what I'm talking about. That patients they're not even allowed to know what they have. It's nuts. You know, I have a patient exactly like you. You won't believe the story. I was just thinking about it. Why don't I like to go to the movies or Broadway? Because my life is more interesting than the movies or Broadway. I have a man just like you with lymphoma in his neck. He had Hodgkin's 15 years ago, and he was treated elsewhere in the right armpit. And he came to us last November with a mass of lymphoma in the neck, huge, like 2 fists. And we offered treatment. We staged him up, just like you. He had no lymphoma anywhere else in his body. And then he didn't come back, and we couldn't understand why he didn't come back. I'm treating him with Dr. Eisen, who's my colleague that takes. Okay, so he mainly devotes himself to the Spanish community. So we treated this. So the man came back a month ago, and like I say, I sit down. I try to close the door, sit down, and spend time with the patient. And I said, I don't understand. You've got a treatable disease. Why don't you want to be treated? And the man confided that he had nowhere to sleep. And between November and April, this man looks like the owner of the restaurant. In fact, my son and I were eating at a little Indian restaurant this week on Lexington and 28th, Indian Curry Hill. And he came by and he saw us. I introduced my son to him, and my son thought he was the owner of the restaurant. But he doesn't have a place to sleep.
What do you mean he didn't have a place to sleep?
He doesn't have a place to sleep, I'm telling you. So this was a month ago. He finally told me why he's not getting treated, because he doesn't have a place to sleep, and he can't get treated until he has a place to sleep. I called up. I made a few calls. I got him a place to sleep. We're treating him. Now, he had a mass the size of 2 fists. His whole left neck was this swollen mass of lymphoma. We started him on focused beam treatment, like I talk about on this show. The mass has gone away. It's incredible. He's happy. We're happy. The mass has gone away, and that's the story for lymphoma. Now, why don't we talk more about lymphoma? Well, our success is not the reason why we don't talk about it very much. When you talk about prostate cancer or breast cancer, there's 250,000 Americans a year who have the prostate and breast, and many with lung and rectal. So lymphoma is kind of an orphan in the corner. It's not so common, but we certainly treat it. For someone who's 85, localized disease. For most lymphomas, you could have our type of treatment, most likely. I have to look at your documents and examine all that. But you could have the treatment and most likely have a great life and most likely live to be 100. So, yes, we treat it. It's effective. It's very sensitive to radiation. It's one of those diseases that can even be cured by focused radiation like we're talking about.
Yeah, well, I guess that's about as far as we can go on the phone, but you've got me more intrigued now, and I guess I have to call the office. Yeah,
call the office, and let's spend an hour, 2 hours. We go through the documents. We'll make copies of all the documents so you will see exactly what you have. You know, often you don't need more than that needle biopsy. It depends what's shown on that needle biopsy. So let's look at the needle biopsy, let's look at the staging, and then we can talk about whether any other testing is necessary, but it's very likely not necessary. I don't like to do unnecessary testing. And then you can learn about your options, and most likely our method of treatment is not only a viable option, but it's one that's very well tolerated. It doesn't have the side effects of chemo throughout your body. Doesn't cause hair loss and nausea and vomiting and suppression of the immune system. So let's speak.
I'll call tomorrow. Thank you.
All right. God bless you and have a great day.
Thanks.
Bye now.
Bye.
So I was going to talk about another man. I was going to introduce it by saying, why don't I need to go to the movies or Broadway? Well, because the patients are so interesting. And yes, I can be a little bit Sherlock Holmes in chasing down the details, putting together loose ends. Listen to this man. He's 87 years old, so just 2 years older than the man we just spoke to. He came to me after he saw doctors in all the hospitals in New York. Guess why he came to me? Well, you won't believe this one. But he's 87. He's widowed. He has 6 children. And 15 years ago, I treated him for prostate cancer. He had a pretty high-risk prostate cancer, PSA 14. He was treated with our premier program, which I talk about all the time. And first of all, guess what? Yes, his prostate cancer, high risk, is in total remission. He had focused treatment in the stereotactic frame and brachytherapy. He's in remission from a PSA 14 prostate cancer. So excellent result number one. That should have encouraged him to come and see me years ago, but he did not come. Reason number two, he's an Irish American, Irish heritage, and like many Irish heritage people, has skin cancers. And he came to me with the top of his left ear cut off and the bottom of his right ear cut off. Oh, my God. He's been seeing all these surgeons, and they're cutting off his body for the skin cancer. Well, obviously, had he come to us years ago, he would have his ear and the right ear and the left ear. But now, even worse, he has a skin cancer occupying most of the forehead on the left side, going down and occupying most of the ear on the left side, including what's called the pre-auricular space, which is the area in front of the ear, and it's infiltrative down to the bone. So he got hooked up with these surgeons, and they were going to cut off the side of the face, they were going to cut off the ear, and then reconstruct, so-called reconstruct. Well, you can't reconstruct an ear. You can reconstruct a conglomeration that looks like maybe to someone who doesn't have very good vision in the ear, but God gave us ears, and it's better to keep your ears. They're shaped, and they do what they do for a reason. Anyway, he was going to get the left side of the face, the forehead, the ear cut off, and then flaps and grafts and multiple surgeries. And finally, he went to this hospital. The surgeons were scheduling him. It was all scheduled. Finally went to the hospital, and the people in the hospital canceled that surgery. Thank God. And he came to me this week, and he said, Doc, what can you do for this? And I said, this is the work we do without the cutting, without the bleeding. This is what we do. In fact, this week we've had about 4 or 5 people with skin cancers that are here for treatment. We have one man with about 4 basal cells on his face. We have a woman with squamous cell on her arm. And this man with a massive basal cell cancer. Yeah, we have a lot of experience doing skin cancer because surgery can't give the kind of results that we can give keeping the ear intact, or the nose or the eyes or the mouth. When those organs are altered, they almost never look the same. I mean, look at his ear. His top of his ear was cut off. He's going around like a little doggy with his top of his ear cut off. Why? Why wasn't he sent to us before? We have a caller, and then we'll continue on here. 1 minute. Good morning. You're on the radio. This is Dr. Lederman.
Hi, Dr. Lederman. I'd seen you 2 years ago about prostate cancer and all, and it's enlarged, recently reduction of the prostate swelling and all the cells were, positive, and also into the adrenals.
Okay, what's your question today?
Yes.
You should come in again. If it's been 2 years, you should come in. We should sit down, close the door, and spend some time together.
Okay, all right. right. That's good. I should call up...
This same number, call up the same number, and I promise to see you within one business day, like I promise everybody, and we'll go over all the details, and we'll